I've lost 222 pounds or nearly 16 stone using Ozempic. When I was at the beginning of my journey, I did a lot of research to try and understand what the medication was and what I could maybe expect from the experience taking it. I was super lucky and I had supportive doctors who were encouraging me to take it, as well as in other interventions from medical staff, including dietitians, explaining what was going to happen to my body if I started taking this medication. However, not everybody has that, and even though I did have that, I found social media really helpful and insightful to kind of understand what would happen and what I could expect from the medication. I think very much for me, when I first started the research, I was very much focusing on accounts that were done by medical professionals or other healthcare professionals that had some kind of qualification as well as experience as practitioners to make it possible for them to talk about GLP-1 medication. I was really conscious that a lot of the content I consumed came out of America, and mainly because that's where a lot of the content comes from on social media, but also they were the pioneers, if you like, in terms of high volume numbers of people using the medication. So a lot of the stories when I first started were really predominantly coming out of America. So that means that I was always conscious and a bit critical of what was happening, because the healthcare system in America is designed to make money. So of course they're going to sell you this thing. However, I was still aware that many medical practitioners kind of certainly were kind of promoting these ideas because they thought that it was helping their patients. Once I had that underpinning understanding from the different medical content creators I had followed, I did also start looking at anecdotal evidence. So individual creators that were sharing their lived experience, sort of not dissimilar to what I'm doing now. And I found that really interesting. It was really insightful. It also helped me understand where the empirical data was producing information, kind of where maybe anecdotal data could be a little bit different. So somebody's individual lived experience might not necessarily be what the average experience is across the board. So that was really interesting. It also helped me see kind of the varieties of way in which it had impacted people. However, I was still critical in understanding that many of these people who maybe had started with just a way to share this like great information they had about GLP-1s were also starting to make money from it. So I was aware that people are still kind of trying to sell me stuff, even if they're quote unquote ordinary people just selling their story, or just sharing their story, I should say. However, social media is a really useful resource. Please use it if you're starting your GLP-1 journey, or even if you're midway through and want to find out more. But just also always be really critical of what people are saying online, including everything that I say. So somebody like me is only ever going to be able to talk about their lived experience. I do not have any kind of medical qualification behind me, and a lot of people are the same. So just be really aware, like listen to the medical staff, listen to the clinical information that you're being given by your own doctor, and take what people say in terms of their lived experience as useful information, but maybe also as well sometimes with a grain of salt.